We welcome now Sam Creekmore. He's a member of the Mississippi House of Representatives, serves at District 14. He's chairman of the Public Health and Human Services Committee. Chairman Creekmore, always good to see you, sir. Thanks for coming in.
Likewise. I always enjoy being in the studio, especially when Rhino's got some good music playing.
Absolutely. All right, so we're kind of in a limbo period right now. We died, I guess, the regular session, and now we're awaiting the governor to call a special session because we didn't get a budget done, and so that's pending, I guess we should say, for fiscal year 26. You hearing anything from leadership there?
I hear rumors, but nothing from leadership. Not to me anyway. I know people are in the building working on that. Not me, but I worked on healthcare stuff and not on the budget this week. So hopefully they're getting closer.
The agencies are getting a little antsy, aren't they?
They are. I've heard from several.
I'm sure. Well, I don't really know what to expect. I mean, it's really hard to dig into it. We could speculate all kind of stuff. Are we going to just focus on the budget? Might we add some other topics to the agenda? Don't know.
Yeah, I hope we do add.
Okay.
As you know, the governor vetoed a very important big bill that we had in public health, the Certificate of Need bill.
Yeah.
So, and I've called his staff and asked them to add that to the call. So hopefully they will.
And his objection was over just one provision that I guess he thought was kind of a carve-out, right?
Right, and it was. It was added on the Senate floor and in the last day. And I didn't disagree with it, but it was something we could have done without and got this more comprehensive CON bill passed without it.
He's always been, to my knowledge, I think he's made it publicly known, a proponent of full repeal of our CON statutes.
Absolutely. I think the last time we were here, I probably didn't do a very good job of describing what CON is.
Yeah.
And, it was created in 1974, and the federal government required all states to have CON, Certificate of Need, and otherwise wouldn't get health care funding. And the federal government does that at time to time. But the purpose was to control health care costs and prevent any unnecessary duplication of health care services. Well, in 1986, the Reagan administration, they lifted that mandate for CON, which since then 35 states have remained in, and Mississippi is one of those 35, and we probably have the most complicated and far-reaching CON law in the United States right now. Yeah. So many services. To build a hospital, if you want to buy medical equipment over $1.5 million, you have to get a Certificate of Need, and that's administered by the Department of Health. It costs money to do it. So since 2020, 2019, the legislature's been trying hard to revamp these CON laws and make it more better for business and hospitals and healthcare, and
hopefully expand the supply.
Something
services. Desperately needed in our state.
Absolutely.
And it's a big hindrance. These CON laws are an impediment.
That's right. Yeah, if you you're a big hospital and you wanted to remodel your lobby and it went over a certain construction cost, you had to apply for a CON.
That's crazy.
That's crazy.
Even parking lots.
Parking lots,
yeah.
That's right. And the other part of it, and I think you would agree, it slows innovation in healthcare when you have a protected healthcare system that nobody else can compete with you. You're not constantly seeking you may be constantly looking to save money or make money, but innovation kind of suffers from that. So this would help, I believe, in innovation in the state of Mississippi, and we need that.
Yeah. What are the objections you hear? So it seems like that Senator Bryan, of course, your counterpart in the Senate, a Democrat, he's not a big proponent of really much change to our current CON infrastructure there.
He's not, and I would define it more as he's very careful.
Okay.
And he, of course, has way more experience than me or most people in the legislature, especially in healthcare. He's done this before.
Oh, wow, yeah.
So we sent a bill over from the House. It was pretty aggressive in CON reform. Of course, I talked to Senator Bryan well before the bill ever passed the House and told him it was coming, and here's what it did. And he doesn't say much. Well, they refined it on the Senate side, and where it really still was a very good bill, and that's where they added that language that the governor didn't like. But what we did, and the biggest thing is increase the capital expenditures. For instance, we were talking about the parking lot or the lobby area. We increased the medical equipment expenditure from 1.5 to $3 million. So you can spend up to $3 million without having to apply for a CON. For clinical services, it was $5 million. We doubled that to $10 million. So if you want to add a service and it costs less than $10 million, you could do that without receiving a CON. And then everything else falls under the category non-clinical, and that's the parking lot and the lobby or gift shop. That was $10 million. Now it's $20 in that bill. Okay. And so that's what we sent to the governor. We also, and I thought this is an important piece, especially for downtown Jackson, the University Medical Center, UMMC, they have a teacher exemption in CON, so they don't have to apply for CON for any of their properties across the state of Mississippi. We limited that exemption to just the downtown area. Therefore, if they wanted to add something new and didn't want to require CON, it would force them to keep it in the downtown metro area of Jackson.
And that's been something that those that don't have similar exemptions that are in the hospital healthcare business, they have complained about.
They have, because
it's understandable.
It is. It is. If you got a hospital that's having to get CON for services, and you got one a mile down the road that doesn't, it's and they're competing. So we try to level the playing field. Yeah,
and I think that's in the best interest of consumers.
I do too.
Patients
as
well. So.
And UMMC they were gracious about it and worked with us on the map and wasn't a lot of pushback.
Okay.
But nobody, make this clear, nobody who has a CON wants to come out of CON because
of course
they're protected. But they didn't. They were very gracious.
Okay. Well, so do you think at this point it would be purely a guess, unless you've heard something more concrete, that the governor would add that to the agenda? Because it sounds like a small change. We get this done.
That's right, and the capital expenditure part would help the rural hospitals now,
big time.
And yes, I think it'll get added, and I'll tell you why.
Okay.
I had two bills that he vetoed this session. One was a Main Street bill, and then he explains why he vetoes it, and doesn't always give a roadmap to getting around the veto. The Main Street bill, he called it a duckbill platypus bill, and just didn't like it. But this bill he did. He said, "Here's what I don't like about it and why." And
he did. He was very explicit,
and even brought it up in the press conference. I may add CON to the call where we can get some real CON reform in Mississippi. So I'm encouraged.
Well, and I know you focus, of course, due to your chairmanship on health care, but I've actually said on the show, and the speaker was on as a guest on another show and repeated it, is that we're all about free markets in Mississippi, except when it comes to health care and education and alcohol and sports betting and vehicle sales. Yeah. Other than that, we're
That's right. That's right.
So we have a president that's very anti-protectionist in terms of domestically. Now he protects the country from outsiders.
He does.
He favors those policies to do that. But hopefully we can get something done here.
I
know
you've
been working hard on this. A lot of people have.
And absolutely, it's not just me. And Hank Zuber's been incredibly good with this. But again, if we can get this passed, there's still more and more we'd like to keep chipping away at.
Yeah.
To help healthcare in Mississippi.
Didn't we have a run at psychiatric care yesterday?
Psychiatric care. Dialysis,
yeah.
And so all that is now going to the State Board of Health for a official study.
Okay.
And so that's the results of that study are due by December 1st, which would give us time to react in the 2026 legislative session.
What's sort of ironic and really just counter to common sense and logic, you know about the history, you talked about it. The idea was we got to keep costs down by limiting supply, right?
That's right. That's right.
That was the premise.
And ironically, we had the lowest healthcare cost in the country in Mississippi.
Yeah, I know. So we need to get this done. We got Sam Creekmore. He is a member of the Mississippi House of Representatives, chairs the Public Health Committee in the House. We're coming right back. We're still visiting with Sam Creekmore. He represents District 14 in the Mississippi House of Representatives. So, Representative Creekmore, is that just Union County, by the way?
It is, and it's not all of Union County.
Okay.
Yeah, Steve Massengill, that's part of it.
Yeah, okay, awesome. And serves as the chair of Public Health and Human Services. We were just talking about an attempt, at least, to do some partial repeal of these rather old CON statutes. I mean, they've been reformed through the years, but the bottom line is there's certain things if a healthcare provider wants to do, whether it's expanding spaces in their parking lot or, like you said, remodeling their lobby. And then adding beds, of course, that's a huge deal. Yeah. Buying certain equipment. Yeah. They got to, Mother May I get permission from the state government. That's the bottom line.
That's it. And pay a lawyer to do it. So, I mean, it just
a bunch of money and time.
That's right.
That's an involved application. That's not something you just snap your fingers and send in an email real quick.
If you're a neighboring medical provider and you don't like the CON that they're applying for, you can
object
to it, and there's an appeal process, and you could be sitting out there for 2 years.
Don't we have enough of that in our government? We got all these boards and stuff and you know this, and you want to set up shop in a certain industry, you often have to go in front of a board that would be your competition, and they have to approve you doing that. Yeah. We need some work there.
We do,
and
we're gonna get it.
Yeah, and I know the governor feels that way. You know, he'd like to perhaps reduce those number of boards. Heck, I don't know how they keep up with all that. I know he's got full-time staff. That's all they do is just deal with all the boards and the appointments because there's so many of them.
Yeah.
I mean, some of those are necessary, some of those are over the top. We'll see what happens. The big legislation, of course, that if you want to talk about it, that is sparked lots of controversy, was the tax reform package. And the way that went down was, shall we say, unusual at best.
Very unusual. And on the House side, obviously, we've been wanting full income tax removal since Speaker Gunn was here.
Sure.
And it passed it. And it to me, it was obvious that the Senate was not on board on a plan to eliminate full income tax. And I get both sides. And I think the rub now, and which has caused this special session, is there's that project money that the House has been strongly in favor of. We've had it every year. But I feel like the Senate and maybe their leadership thinks that money needs to set as a reserve.
Explain that to the audience, what you mean by project money.
Well, at the end of every session, legislators, senators, and House members send in lists for projects for maybe a road for their county or a new bridge for the city or a park. And the leadership prioritizes that and then will award, not all, but most legislatures, with some money to take back home.
Yeah.
And it's important I know it's important to my Union County and New Albany, and just like it is everybody else. And the Senate or their leadership wants to just set aside that money for this year and not have any project money. And I understand that 100%, especially with the uncertainty of elimination of income tax. Mm-hmm. However, our models show that we should experience growth, and we're not completely eliminating income tax by any means come July 1.
Yeah, not yet. That's absolutely true. Yeah. But it is true, I think you'd have to agree, that we are going to see declining, we already are, revenues from income taxes. We're seeing that just because of the legislation passed in 22.
That's right.
And we reduced the rate, got rid of the 4%, and then we're trimming the remaining 5% down to 4%. Mm-hmm. It will hit 4% for the calendar year 2026, and then after that, we're going down to 3% in accordance with the legislation passed in this session, and then over a period of time down to 0. And we will transition to being relying fully on revenue collected from sales taxes at that point, for the most part.
Yeah, absolutely, and we're hoping with this income tax reduction will be a lot more growth.
It's going to require that.
It's going to have it
to make ends meet.
That's right.
And it can't come from the existing population, because that would require them to step up their spending by about a third, and that's not, if you do the math, and that's likely not to happen.
I can't do that.
Yeah, I don't think most Mississippians can't. So we do need more people. Honestly, in our state.
And we need them for the workforce.
Yeah.
Union County, where I'm from, has the lowest unemployment rate in the state. And it's just hard to find jobs or find people for the jobs.
Yeah. It's still, even with in the wake of the last 4 years under Joe Biden, where we had inflation and somewhat of an impact that had, but we still have a low unemployment rate nationwide. Our unemployment rate is also backed up some, and I talk to employers as well that say, we just can't find the people we need. Still have a problem with that.
And I was thinking about that as I was driving up here about the new $4 billion industrial park in
Grenada.
Yeah. And I'm thinking, they just got Milwaukee's industry, and I mean they're going to be pulling people. But the good news, I think they'll be pulling people from the Delta too.
I do too.
That will really help that.
Well, that's typically what happens at those parks. Whatever gets built there on those sites usually ends up employing people on a kind of a regional basis. They're not just in the local community. Well, this is something I think you have to give credit to the governor on. He recognized a while back that, getting these sites ready to go is key.
And I think he would have been doing this a lot sooner had COVID not hit. I mean, it just kind of sucked all the air out of the room, and that's all he could concentrate on.
I agree. Well, I can tell you with personal experience, it was pivotal in our landing the big AWS project with some risk and investment we made in Madison County to develop that site, acquire that land, develop that site, get it ready to go.
Those are the special sessions that I really like.
Yeah, it's that's fun, and there's more coming there too as well. But this tax deal was really controversial, as we talked about the way that went down, and I think it has kind of put a wedge, unfortunately, between the two chambers.
It has, and I hate it. And outside the Capitol, we're friends, but there's some hurt feelings in this, and I understand why. Yeah.
Well, we'll see where that goes. So. Something that I wanted to get your thoughts on is this attempt to get some form of school choice passed in the state of Mississippi, which it's kind of like repealing the CON. We keep trying, and we don't get it. I just got an email. I was just telling you offline that it looks like Rhino, South Carolina, becoming now the next state to enact universal school choice. That's in the wake of Texas just doing that a couple of weeks ago. So, again, looking at that map, Representative Creekmore, we're like the state that's sticking out, certainly across the southern half of the country here.
It is, and that was discussed in the legislature. The chairman, Rob Robertson, was like, gentlemen, it's coming. Ladies and gentlemen, it's coming.
It's coming, yeah.
And we can do it now, or we're going to be the last one to do it.
Yeah.
And I thought Representative Owens had a good bill, good start to school choice.
That's like entry-level school choice, public-to-public transfer.
That's right. And which we kind of have now, but this just removes some of the red tape. And I thought that was a good way to start. And the mamas and daddies could realize, well, the sky didn't fall, and we can move on. And maybe then we can expand it.
Well, there's been some buzz that maybe that'll make its way into a special session, but I don't see the governor doing that unless he knows he's got the votes.
He's also made a comment he doesn't want us down here very long, and I don't want to be down here very long. So I think that one, especially the way it went in the regular session, could really last a while.
Yeah. Now, I know last year Medicaid was a big topic in your domain there, but this year it wasn't, and I think rightfully so because of the uncertainty with the federal government.
Absolutely, and we met early on. Speaker and I did, and we both were on the same sheet of music. We don't know what the Trump administration is going to do with Medicaid. There's no point in us putting all this, every legislator, House and Senate, through this again when it could all change, in a month.
Yeah. And we
still don't know.
We still don't know, right? And I think we're going to have some clarity here in the next month or so when the Congress acts and passes this budget resolution.
I think so.
The president did submit his plan, which is a requirement under our laws, and so the Congress is mulling that over, and we'll see where that goes. But yeah, I think you got to wait and see what happens there.
I thought that was a smart thing.
Could be looking at some
we
cuts.
Finally did something smart.
Yeah, could be looking at cuts to the existing program, which could put a little pressure on.
That's scaring people.
Appreciate you coming in, Representative Sam Creekmore.
Always enjoy it.
Thanks a lot, man.
Thank you.
Folks, we're stepping aside for a break. We're coming right back in the Element Wealth studio.